Good afternoon, esteemed members of the leadership and clinical team. My name is Michelle Rubin, and today I'm presenting our newly developed healthcare policy, Transitional Care Management and 30-Day Readmission Reduction Policy for our heart failure patients. This presentation serves as an overview of our strategic policy implementation plan to bridge a gap in our clinical outcomes. Our organization, while above the regulatory percentage, still faces a gap regarding our heart failure patients. Too many individuals return to an acute care bed within 30 days of discharge due to preventable care gaps such as conflicting medication instructions or delayed outpatient appointments. These issues compromise safety, spikes mortality risk, and clogs our inpatient capacity. We must implement a structured workflow to protect our patients and optimize our clinical throughput. To contextualize our progress, let's examine the data. According to the Centers for Medicare and Medicaid Services Hospital Readmissions Reduction Program, the national average readmission rate for heart failure patients is 21.1%. Our organization has successfully driven our current performance rate down to 19.5. This represents a favorable variance of 1.6 compared to the national average, firmly classifying our facility as a positive outlier for federal qualifying scoring metrics. This policy is driven directly by federal law, Section 3025 of the Affordable Care Act mandates, and it mandates penalties for hospitals with excessive readmissions via the HRRP. The federal government can withhold up to 3% of our base Medicare reimbursements. Exceeding the benchmark places millions of dollars of our revenue at risk, fully justifying this policy as both a financial necessity and a regulatory requirement. The policy addresses this gap by standardizing the heart care bundle across all inpatient units. Its purpose is to ensure no heart failure patient leaves our facility without a verified follow-up appointment within 7 days, formalized teach-back education, complete pharmacist medication reconciliation, a scheduled 48-hour check-in phone call, and thorough documentation in our EHR. Ethically, this policy fulfills our commitment to beneficence and justice by assuring safe care transitions for all individuals. Regardless of socioeconomic background, culturally, we recognize our diverse patient demographic. We have incorporated translated materials and low literacy toolkits to remain accessible while safeguarding vulnerable populations from facing a disproportionate home care burden. Our stakeholders are the engines of this change. Internally, hospitalists, nurses, pharmacists, and care managers own the clinical workflows, while IT builds our EHR tracking. Externally, our primary care partners, community cardiologists, and home health agencies receive our patients post-discharge. Success requires alignment between our internal providers and our external community networks. To break down clinical silos, we will employ daily multidisciplinary huddles where nurses, pharmacists, and case managers review every heart failure patient simultaneously. We are introducing automated EHR triggers to notify pharmacy teams immediately upon a patient's admission, allowing for early medication review. This strategy removes individual communication friction and fosters shared clinical accountability. Implementation will utilize a phased approach starting with a 30-day pilot on our 3 East Cardiac Unit before deploying hospital-wide within 90 days. Success will be monitored via live EHR compliance dashboards. Unit managers will be responsible for overseeing a day-to-day staff adherence, while our quality improvement director will monitor overall readmission metrics. In conclusion, this policy transforms our approach to heart failure care transitions, aligns our clinical workflow with federal compliance mandates. Your individual engagement and collaboration are essential for bridging this outcome gap. By executing this bundle, our target is to reduce readmissions below 16% within the year. Thank you for your leadership and dedication. I look forward to working alongside of each of you.